Are setting new COVID case records almost daily in the state of Wisconsin. And now we're joined by Dr. Jeffrey Potoff from UW Health for, a kind of clarification on some of these questions. Of course, COVID cases. I do want to ask you this. Are we at the peak of COVID cases here in the state, or will we be soon?
Yeah, I think, it's anybody's guess. I think with Omicron being so contagious, the going theory is that it will reach peak a bit sooner than we saw with Delta. But I do think we may have a little bit more to go as far as peak cases, especially if no additional actions are taken to try to slow the spread in the next couple of days to weeks.
So once that happens, Dr. Potoff, are we going to see a hospital and death surge possibly following that peak?
I think we're already starting to see a bit of surge on some hospitals. I think it's a common misconception that Omicron cannot cause severe disease. It's just a milder form of COVID. And that's not the right interpretation. As a total percent of people who get Omicron, less will be hospitalized. But so many are coming down with it that we are seeing hospitals push a little bit north in some of our health systems, creating some capacity issues.
So as we know, hospitals taking a big hit here, but also school districts. Do we know when, or do we expect when they could get a break? Is it just a matter of time? Does vaccination, use of masks, does that play a part in this?
There are things that we can do to keep schools open and do it safely so that those students and those educators aren't at risk. And the first thing that we need to do is we need to get mask mandates back in school. There really is no way to slow the spread if we have those kids in school with their teachers unmasked. It's just going to get passed around, and that's what we're seeing. Secondarily, vaccination. Higher vaccination rates in those school-aged kids would decrease the number of them that come down with COVID, decrease the number who could spread it. That would also slow transmission. But those are some of the things that need to be considered as we see these huge case numbers in Wisconsin.
And speaking on masks here, now that we know that Milwaukee is handing out masks to singles, families, and couples as well, what do you recommend in terms of which ones we should be using and why maybe we should think about getting something other than just a cloth?
With Omicron being so contagious, what we really want is a nice, tight-fitting mask. Now, the tightest fitting mask that's easily available is an N95 or a KN95, and that does likely provide the best protection. That's not to say that a surgical mask that's well fitted to your face, where the straps are adjusted to provide a good fit, is not a viable option. That works pretty well too. I think the issue with cloth masks is there's just so much variation on whether that's tight-fitting, whether it's a couple layers, a single layer. It's just hard to know necessarily what you're getting. Hence the move to some of these more standardized masks, surgical masks, N95s, KN95s, as we're battling this very contagious variant.
Now, one quick question before we let you go, Dr. Jeffrey Potoff here. How many times should we be using those masks? I feel like sometimes we keep them for too long. Sometimes it's like a one and done.
It's a good question. There isn't a lot of literature out there. If they could become visibly soiled, you want to replace them for a new mask. For most of these paper masks, KN95s, 95s, and surgical masks, I would say, on the order of about 2 days is probably a reasonable length of time to wear them, knowing that at that point you may be losing a little bit of efficacy. But if that's not possible, extending that out a few more days likely wouldn't hurt.